Welcome to the Enlightened Pet Behavior Podcast. I'm your host, Susan Light. In a world overflowing with conflicting advice and often misguided information, my mission is to be your trusted source for accurate, kind, and truly effective strategies to understand and shape your pet's behavior. Join me as we shed light on common challenges and work to foster a deeper, more harmonious bond with our beloved furry family members. If you find the show helpful and enjoyable, please consider showing your support. Subscribing, following, rating, reviewing, and sharing with friends takes just a minute, but it significantly boosts the show's visibility, helping more pet parents discover it. Thank you for your support. Let's get into it. I'm going to be bringing you an encore today of another one of my most listened to episodes, and honestly, I think one of my most useful episodes where I learned so much. It's about canine dentistry, and I'm going to drop you into the old intro because it's very thorough, but please enjoy. My clients have all kinds of questions about how to care for their dog's teeth. What does bad breath mean? What's safe and not safe for them to chew on? What about non-anesthetic teeth cleanings? And with so much conflicting information out there, I wanted to find a really reputable source to help sort it all out. And why is there so much conflicting information? According to my guest, it's because most veterinarians leave school with zero education about dentistry. Zero. It's not even covered. Yet they're legally able to perform any and all parts of it and are often trained on the job by someone who has had no formal training in veterinary dentistry either. There are fewer than 200 board-certified veterinary dentists in the world. But thankfully, many of these passionate professionals dedicate a lot of their time to teaching other veterinarians how to properly care for teeth in dogs and cats. My guest literally wrote the book, the textbook, Small Animal Dental, Oral, and Maxillofacial Disease. He is a fellow in the Academy of Veterinary Dentistry. He's chief of staff in veterinary dental specialties and oral surgery with 15 offices throughout the United States. Please welcome Dr. Brook Niemiec. Dr. Niemiec, thank you so much for coming to talk to me today.
You are very welcome.
In terms of dental health first, is there different advice for puppies with their puppy teeth versus adults with adult teeth, or is a lot of it the same across the board?
Well, I mean, it's the same across the board, except for the fact that they don't have their puppy teeth very long. Human children, they have their baby teeth for years and years and years. So it's long enough for them to get cavities in it. It's long enough for them to break it. It's long enough for them to have all these other things. Our dogs only really have their puppy teeth for a few months. Usually by 6 months, all the adult teeth are in. They erupt around 2 to 3 months, 2 months-ish. There's when they get their puppy teeth in because they're not born with puppy teeth. And that's why they're called milk teeth, because when the teeth come in and they are, they're drinking on their mom's like, ouch, that hurts now. So when they erupt their teeth is the signal to the mom to say, stop suckling.
To wean them.
And so, wean them. And so they get it about, maybe 2 months, and then they're gone the incisors start going away at 4 months. So they really don't have them very long. So they don't get gum disease. They don't get anything like that. They do break them. The two big things with puppies are that they do break their puppy teeth. And yes, they need to come out because they hurt and they can get infected. And then you get orthodontic problems. So if they have a bite problem, a doggy braces issue, they can get what's called a traumatic malocclusion, where their puppy teeth bite into their palate or their gum or their lip. And if you've ever been bitten by a puppy, it hurts.
Mm-hmm.
So those teeth need to be treated. So really the two things, there are a bunch of things that puppies can get. I have a whole lecture on pediatric dentistry. But the big things are malocclusions, which are causing trauma, broken puppy teeth, and then retained puppy teeth, because it's not unusual for the adult tooth to come in and you'll have a puppy tooth and the adult tooth there together, and that causes gum disease and orthodontic disease. So you need to get those puppy teeth out now. But those are the big things you see in puppies.
Interesting. So speaking of those sharp, sharp puppy teeth, while they're got those sharp puppy teeth, we're trying to give them things to chew. What is or isn't safe to give them to chew? This I think is a huge topic because there's no regulation and there's so many things out there that I feel like they shouldn't be chewing on.
You are correct, 100%. So there's two different ways to discuss the safety of it. One is the tooth breaking side of it, and then the other side is the obstruction swallowing thing of it.
Yep.
And I will tell you that I'm a veterinary dentist. I have really, in all my years of being a veterinary dentist, I have never had a dog that is one of my clients choke on something. But they can choke on anything. So, you got to watch your dog when you're giving something because some dogs are just gulpers and they're going to swallow stuff. I do want to throw out there, speaking of safety, only because I know this really, really well, that there was a, uh, a problem many, many years ago that people developed an aversion to greenies because greenies were being seen as being obstructive. And and I still hear from veterinarians. I want anyone out there that feels that this is a concern to just stop being concerned at all. Because I still hear from veterinarians all the time about the fact that dogs would swallow greenies whole and then they'd have to go take them out of the stomach or something. And greenies completely reformulated their product. I mean, 15 years ago. It's been forever. Yet that prejudice remains. So they are more digestible now than dog food is. So
Okay.
there's no, I mean, could they still bolt something? They could do anything. Rawhides, any of the chew things, they can always swallow it, of course. But I tell you, I think greenies are a great product. I think they work for gum disease to a certain extent. So the swallowing and obstructive thing, I mean, pretty much any treat, anything you give them, unless it's just the size of a dog food, anything can have that happen. So there's nothing more or less. The big thing is from a veterinary dentist standpoint, are things that are too hard.
Mm.
The problem is, and this is a issue that every veterinary or every large breed dog owner has, is that they want to give their dog something to chew on. The issue is anything that is good for the dog to chew on, safe for the dog to chew on from a dental standpoint, is going to be gone in 60 seconds if you have a big chew or less. It might be one chomp and gone. So the problem is that everyone wants to give their dog hard things.
Mm.
And the big thing, nylon bones,
Indestructible things.
yes, pig
Yeah.
hooves, all those things. And the issue with that is something's got to give. If you're chewing on that, either the product's going to give, the chew treat's going to give, or the tooth is going to give. And so we, as veterinary dentists, see fractured teeth all the time from these hard bones. And bones, standard bones, especially if they're cooked, can do it. Honestly, it depends on the formulation. I've seen bully sticks do it.
Really?
Oh yeah, I've seen.
Mm.
There's the yak thing where
The yak chews, yeah.
yeah, well, anything. So here's our rule of thumb as a veterinary dentist. So literal rule of thumb: if you can make an indentation into the product with your fingernail, it's okay for your dog to chew on. If you can't, it's too hard.
Mm.
The other thing that people use is if it would hurt to hit yourself in the knee with it, then don't. It shouldn't be going in your dog's mouth. So the issue is that all of those products that we have that are soft like that are gone. I mean, you give them a juicer, it means just one bite and gone in these big dogs. So, I mean, I do really like Kongs. I think Kongs are safe in most cases. I like rawhide chews. I think rawhides are great. They're good for their teeth too. I like rope toys, sheepskin toys. But again, the sheepskin toys are going to be gone in 60 seconds. The dogs are going to chew them up. So those type of soft things are fine. But when you get into those things that you can't make an indentation with, they're just going to break the teeth. And 10%, here's the thing, study, 10% of dogs have a broken tooth in their mouth with direct pulp exposure. So the nerve is directly exposed in 10% of dogs. And at the dentin, the underlying tooth structure is lost in 50% of dogs. And so that means that well over half of our dogs out there have damaged their teeth, and they have they're in pain. It's either like having a wicked cavity or having your nerve exposed.
Oh, man.
And literally, if I just fixed what are called uncomplicated crown fractures, I mean, they've broken the tooth not directly into the root canal, but into what's called the dentin, the underlying tooth structure. If I just treated those, I mean, I could probably not keep up. Like if all I did all day was do sealants on these dogs that have chipped their teeth off, I'll bet you I could not keep up with the cases in San Diego because there's hundreds of them happening every day.
Well, this is what kills me whenever I try to tell parents not to give their dogs these things. Some of them will fight you on it. They're like, "I've never had a dog have a cracked tooth." And I mean, the thing is, you probably don't know that they have a cracked tooth
Exactly.
until
Yeah.
you take them in and get them a dental.
Right. Well, I mean, you could do an oral exam and you could see it on a wake exam, but in dogs, and you and we have very thick enamel. So we're omnivores. So we're grinders. So grinders, like horses, like rabbits, they have very thick enamel. And in horses and rabbits, they continually erupt their teeth because they wear them down because they're grinders. Dogs and cats are carnivores. And as carnivores, they're slicers. So they don't have thick enamel. It's essentially impossible to break a dog's tooth without exposing the dentin.
Ugh.
That dentin hurts. It's like having a wicked cavity. So it could be a 1 or 2 millimeter fracture, just a little tiny thing, and it's enough to expose the dentin, which is painful and can get infected. They can become an abscess tooth. Actually, as a matter of fact, a study I did a few years ago, that British most showed that about 20% of chip fractured teeth, not with direct nerve exposure, but chip fractured teeth, were enough to get infected.
Wow.
Happens all the time.
That's crazy. So from the tooth perspective, rawhides are good because I've always heard that they can cause obstructions from the
I think
big pieces that they swallow.
everything can. I mean,
So,
anything you
okay.
give a dog can. And again, I hesitate to say this because there's lawyers in the world.
Sure.
I have been, no offense, lawyers, but I have to be careful with what I say sometimes. I'm very passionate. I have been prescribing rawhides for 20 years personally. Now I know, yes, there are reports of it. It does happen. Dogs can get an obstruction from a rawhide, but they can get an obstruction from anything they pick up. I have so many dogs
Okay.
that chew on socks and they get infected and all these things, nylons and all these.
Stuffings of toys.
Yeah, I mean, there's so many things. From a risk-benefit ratio, I think that rawhides are pretty darn safe. Now, there is a company called, and I am not paid by this company to say this at all. I want you to say that I guess one of the things we should have said right from the get-go is I do speak for a lot of companies. I do. I lecture. I haven't lectured for 10 years for Greenies, but I did. So I learned a lot. But, Veerback and BI and Hill's Pet Nutrition, and I've lectured for tons of companies. I do get paid for lecturing for them, but I only lecture for them because I believe in their products. Siva, don't believe I've ever been paid by them, so I can totally say this thing. Siva makes a product called breakables. And so they're rawhides that actually break like a chew treat would, like a biscuit would. And so I don't know that it's as effective for gum disease as, a standard rawhide because they don't have to chew it as much. But the obstructive chances are way less with the breakables. So, I mean, there's lots of options out there. But really, again, I've been doing this for over 20 years. I have yet to have a dog choke on anything that I've sold. I've sold a lot of rawhides.
That's good to know. Yeah.
I don't worry so much about it. Now, of course, I'm going to say this someone's going to buy it and they're about to choke on it, of course.
Well,
But
yeah.
in general, it again, risk benefit ratio, right? You could jump on the peach pit when you have it. You could get into a car accident. I think from a risk benefit ratio, I can guarantee you, if you give a dog something that you can't make an indentation with your fingernail, it's going to break a tooth. It is.
Yeah. So you do think that there are chews that are beneficial for chewing. Are there treats? Like, what are the best things you can give them to maintain their teeth?
Okay. A couple things, and they're really, and this is an area of what's what I'm looking for, intense research of mine, because I wrote, for your audience's information, I did write the book on periodontal disease, gum disease in dogs and cats. So I did all the research. I'm just getting ready actually to revise it for a second edition. The vast majority of products out there, if you go to the pet store, you go online, any of the online things, the vast majority of products that claim to be dental treats or dental diets, the majority of them they have zero scientific proof that they do anything. I mean, how many things do you know?
Yeah, but it's proven that.
Yeah, and then it's like, oh, and a doctor, they'll have a testimonial from Dr. Smith or something like, no offense, Dr. Smith, and they go, oh, this guy here loves it, and I'm just like, yeah, but where's the scientific evidence? Um, where's the proof? And they're like, well, we don't have any, but look at this pretty picture.
Yeah.
And so the problem is that the vast majority of products that are out there that claim efficiency have zero scientific evidence they do anything. They could be the greatest thing since sliced bread. I mean, they could cure gum disease, but they have no scientific evidence that they actually do anything. So when you are looking for a treat for your pet, I would ask your veterinarian. That's going to be my number one thing. Ask your vet what they recommend, and hopefully they've done the research. And there's a thing called the Veterinary Oral Health Council, bohc.org. You can go on the BOHC website and be like I said, bohc.org, and it'll list all the products that they have tested. That shows that they work against plaque and calculus. Here's the problem. This is because I look beyond the research, because again, I tell people all the time, for your audience to know, I'm not that smart. I mean, I was a C equals DBM, that we call it. They say, what do you call the person that graduates last in their vet school class?
I don't know.
Yeah, I'm doctor, because we passed, right?
Yeah.
I was down to that level, to be honest. I'm not that smart, but I've written 13, 14 textbooks. And so I do the research and I learn these things. But when I was doing the research, what I found, and here's the thing, we could talk about this ad nauseum if you want, but in order for a product or a service or whatever, when you're dealing with gum disease, the area that you need to clean is at and below the gum line. The area on the surface of the tooth, the plaque on the surface of the tooth, the tartar, when you lift up your dog's lift and it's coated with tartar, that's all cosmetic. It's the stuff up underneath the gum that creates the inflammation that starts as gingivitis and then proceeds into periodontitis. And then you get bone loss and loose teeth, you have to extract the tooth, and all the other bad things that happen. So the problem is that the vast majority of these products that are out there do a decent job cleaning the surface of the teeth, but they don't get down to the gum line. So even if they do have studies that show that they decrease 20, 30, 40, 50% of calculus, if it's at the surface of the tooth, it's not doing anything medically for the patient. So you need to look for products that are soft, that the dog has to chew through, and it holds onto the teeth. So my short list, if I'm going to pick one product, I have one product that I can use and I don't get to use any other one. It's going to be a product called TD, Tooth Diet, from Hills Pet Nutrition. They also make oral care, which is a non-prescription version of it. If I'm going to pick one product, it's going to be TD, dogs and cats. It's amazing as far as decreasing the amount of gum disease. It's also a maintenance diet. You can feed it just constantly. Just give it to your dog every day.
Oh, it's a food or
It's
it's
a
a
food.
treat?
It's a food.
Okay.
Now,
Okay.
you can use it as a treat, but the more you feed it, the better. And it was for a while, I'm not sure that it still is, the number one maintenance diet in Canada, because it is a well-balanced, very nutritionally solid diet that just happens to be phenomenal for keeping teeth clean. So if I'm going to pick one product out there, it's going to be Hills TD. The other product that I really like for dogs is from a company called BI. It's two German names that I'm not even going to try and pronounce. But BI is the company. It's called Oravet, which is ORA, like oral, and then VET. And it's a chew, and it is a treat. And it has a product called Dimopinol, which is an antiseptic in it, and it actually helps. I do like greenies. I like rawhides. Cats, TD again. TD's I mean, if you're going to say what's your number one, TD for cats too. They have small bites for small dogs. I mean, it's great. They do have some chew-based treats for cats. Veerback has one called IntelliBites, I believe. Tartar Shield's out there. So there's a lot of options that I think. But if I'm going to pick it, it's going to be TD, or it's going to be or vet dental hygiene chews. Or, I mean, again, I like rawhides. I like greenies. I think they work.
Good to know.
Yeah.
What about those additives you put in the water that are supposed to improve their breath?
Yeah,
and things
again,
like that.
I'm not a big believer in water additives. Now I know some of them have BOHC approval, and I know that the Veerback one, Aquadent, has Aquadent does have BOHC approval, and it actually does have a study. I'll be honest, I'll probably get in trouble for this, but I don't blindly believe the BOHC, even though I'm supposed to as a veterinary dentist. I mean, I think that if you have BOHC approval, you have a modicum of, knowledge base that it probably is helpful. But I like to see the research. I'm a scientist. And I like to use it. I like to see the actual research published, and the Aquadent product actually has been published. From a standpoint of scientific knowledge, plaque, biofilm, bacteria within a biofilm, which is what plaque is a biofilm, which is a layer of bacteria that's protected with glycoproteins and stuff. It takes I think it's 50,000 times the concentration of antiseptics to kill a plaque bacteria as it does a singular bacteria,
Well,
which is
draw.
which is why we wipe our surfaces, right? You don't just spray if you're cleaning your kitchen sink, you don't just spray it. You spray it and then you wipe it. The reason that you're wiping it is you're breaking up the biofilm so that the antiseptic can get into the biofilm. So again, I am not a believer in water additives. I will essentially never prescribe them. There are some that do have some scientific evidence that evidently they work. I have a problem with it. There is one product that's out there that is intriguing, which is seaweed based. It's called Plaque Off, Plaque, I believe, off. Plaque Off. It's out of Sweden, and it is basically seaweed that you kind of sprinkle it on the food, and it works systemically. Being honest, no one knows how it works.
Huh.
No one knows any idea how it works, although they do have studies. It was actually done by a friend of mine in Poland that it actually does work. It's called Plaque Off, and it's from Sweden Care. And I would say that if your dog is not orally active, if your cat's not orally active, if you can't brush their teeth, it would be something because you just sprinkle it on their food and they eat it. The only negative that we have seen with it is if it is a lot of iodine in it because it's seaweed, and so hyperthyroid cats can have an issue with it. But I don't think there's any contraindication in dogs.
You can find Dr. Niemiec online at www.dogbeachvet.com or www.drbrookniemiec.com. That's spelled BROOKNIEMIEC. I've put those links and his Instagram and Facebook pages in the show notes. We'll be right back. So, speaking of breath, because usually the water additives are aimed at bad breath, is bad breath a sign that they need some dental care?
Absolutely. Yep, it is. I I'm talking about writing books. I actually went after in the internal medicine book. There's
About bad breath?
yes. The Bible of excuse me if you're not Christian and you're upset by books. But what we call the Bible, the definitive textbook on internal medicine in dogs and cats is by a guy named Steve Ettinger. And he doesn't write it anymore, but it's his book. He's the one that started it. He's a cardiologist up in I think he's retired by now, but I love Steve. He's so great. Very unassuming, brilliant man. And so Ettinger's was the tome or whatever of it. And I wrote the chapter on halitosis or bad breath in dogs. And I did all the research on it. And if your dog is fat and happy and eating and active and normal and looks great and is not sick and has bad breath, they have gum disease. And they have bad gum disease. By the time you are noticing bad breath in your dog, you're probably talking extractions for the most part.
Wow.
Because if you have a dog that has bad breath from liver disease or from diabetes or from kidney disease, those animals are sick by that time. And just really quick, the way that bad breath happens in a dog, when you have pockets, you must have pockets. I told you at the beginning, the stuff on the surface of the teeth, the tartar on the surface of the teeth or calculus, and the bacteria, the supragingival, we call it plaque, does nothing to your patient or your pet or you. It's all cosmetic.
Mm.
When the bacteria finds its way underneath the gum, like when you go to the dentist, they're probing around, counting those 2, 3, 4 millimeter pockets, hopefully not sevens, eights, and nines. When you have pockets, the bacteria are protected from the air. The bacteria on the surface of the teeth, on our skin, on our thing, those are called anaerobic bacteria or aerobic bacteria. So they use oxygen, kind of like Richard Simmons, right? Aerobics, you're using oxygen.
Hmm.
Anaerobic, meaning they don't use oxygen. Those are the bacteria that cause gum disease. Okay. So the anaerobic bacteria are the ones that are bad. They are only allowed to exist under the gum because when they're exposed to oxygen, the aerobic bacteria outcompete them. So the anaerobic bacteria only live in pockets. The anaerobic bacteria, when they respire, when they make their energy, they their energy comes from the dog. By the way, the dog is getting white blood cells and proteins out into the gums to try and fight them off, and then they eat them. When they digest the protein, they break the protein down, and one of the amino acids has sulfur in it. And when they respire, they create hydrogen sulfide. Hydrogen sulfide is the rotten egg smell that they put in natural gas lines. So you smell. So that rotten egg smell is hydrogen sulfide. That is being produced by anaerobic bacteria. When you have that rotten egg bad smell, you know you have periodontal disease, and it's usually advanced. Usually, if I have a dog that I can notice halitosis, I'm telling the client there's probably, and you could have a bunch of small pockets that just need to be cleaned up. But in general, if you notice your dog has bad breath, he probably has advanced gum disease and probably needs extractions 98% of the time. The study that was the 3 studies actually that were published in the last 5 years, 90% of dogs at 1 year of age have gum disease.
That's crazy.
90%.
At
30% of dogs under 10 are 1 year of age. And the reason for that is, people say, I've had animals all my life and they've never had gum disease. Yes, because they've had Labradors or Rottweilers or Shepherds or real dogs. But the problem is that what we have done, and we've bred these animals down, when we get these dogs under 10 pounds, they are genetically prone, because I wrote this book too, they are genetically prone to gum disease. And so why we're seeing an explosion of gum disease in dogs now, as opposed to 30 years ago, is because we have small breed dogs. And small breed dogs have the perfect storm of reasons that they get bad gum disease. Number 1, they live longer. Little dogs live longer than big dogs do.
Yeah.
Number 2, their teeth are all crammed together. So they lose their natural cleaning ability. Number 3, they have shorter roots, so they tend to get into worse gum disease. Number 4, they're not orally active. So the chew-based treats aren't as effective in a Yorkie as they are in a Labrador, because in general, and again, this is a rash generalization,
Sure.
but small breed dogs don't tend to be orally active. Number 5, little dogs tend to be persnickety and don't let you brush their teeth. My Labrador, I could literally, with Sage, I could probably cut her arm off and without anesthesia. And she'd be like, okay, Dad, whatever you think's best for me, I don't mind. But a little dog, you're like, oh, don't touch my mouth, I'm going to bite you. And again, rash generalization, there are little dogs that you can brush their teeth. But in general, they won't allow it. Plus, it's hard to get in there. But the big reason is genetics. Little dogs are just genetically prone to gum disease. There's certain people that are. My family is horrifically prone to gum disease. And they've done several studies, even within breeds. I mean, there's certain families or litters of Labrador retrievers that got really bad gum disease, and some didn't get it at all. And there are big dogs that get bad gum disease. Greyhounds get horrible gum disease. Cavalier King Charles Spaniels, horrible gum disease. Jack Russell Terriers don't. So it's within breeds. But again, there are some Jack Russell Terriers that get horrible gum disease. There are some Cavalier King Charles Spaniels that don't. So but it is a genetic component, and that's why little dogs get it. And that is why I'd say little dogs are not small, big dogs when it comes to gum disease, because they get it way worse. And so a lot of our, then that's again, you talk about the misconceptions. We in veterinary medicine are trained on a 1980s model of dog.
Wow.
A 1980s model of dog is a Labrador, is a Rottweiler, is a Shepherd, is a Border Collie. Nowadays, we treat Yorkies, Poodles, and Maltese, and we keep putting them smaller and smaller.
I know, mini size.
I treated a 0.7 kilogram dog the other day.
Oh my God.
And I tell people all the time, that's not a dog. It's a hamster. And so the problem is we bred them down and we've made them more prone. And so the issue is that, everybody, if you go to your veterinarian, so often, if you go to your veterinarian, they're going to go, oh, your dog's only 2. Oh, he doesn't need a cleaning yet. He's 3. He doesn't need a cleaning.
Yeah.
He's 4. Yeah, 4 years old. Let's do a cleaning. If you have a Labrador or a Rottweiler, yeah, 4 years old's about the right time to do a first cleaning. If you got a Yorkie, it's 3 years too late.
Wow.
And like I said, they all have gum disease at 9 months of age. And I have done, and again, I could talk forever on this. But it's not unusual for me to extract every single tooth in a 4-year-old dog
Oh my God.
because they haven't had any treatment done. So here's just the big thing. And I was an author on the dental guidelines for the World Small Animal Veterinary Association. But the World Small Animal Veterinary Association and the American Animal Hospital Association, both guidelines that came out in 2019, 2020, all dogs under 10 pounds get their first dentistry before a year of age.
So like 9 months?
9 months, 10 months, 11
Great.
months. Yep.
Okay.
Yep.
Yep.
Yeah. And home care should start at 6 months.
So
Go
let's
ahead.
talk about that, brushing the dog's teeth. So should start at 6 months for small dogs, for all dogs?
All dogs.
Yeah.
I would see when they get their adult teeth in. Now,
Okay.
there's nothing wrong with brushing puppy teeth. I mean, it's just
Get
there's
some
no
used to it, right?
get some used to it. Exactly. So I would tell you that as soon as you get your puppy, the day you get your puppy, get your hand in that animal's mouth.
Yep.
Start putting your hand in their mouth and making it positive. Give them that food treat.
Absolutely.
Do something positive, whether it's a walk, whether it's a good dog, whether it's a food treat if they're food motivated, which is great because that's the other thing. Little dogs aren't typically food motivated. Big dogs are. But my dog loves to have her teeth brushed. Why? She gets dinner afterwards. She's a Labrador. Closest they'ing to a pig. I mean, they'll just eat. But you got to get them ready. As soon as you get that dog, get your hand in their mouth, but make it positive and go slow. You don't just shove your hand in their mouth, just like touch their face, give them a treat, lift up the lip, give them a treat. And you can start brushing at 3-4 months of age if you want, getting the toothbrush in there. But when you really want to start brushing is, 6 months when that adult tooth erupts, and then just keep it up, ideally every day. But the more you can do it, the better. And there are veterinary dentists who are draconian or like, if you don't brush every day, don't bother. And I'm like, it's kind of like saying, if you go to the gym every day, don't bother. It's like, no, if you can go twice a week, that's better than nothing.
Yeah.
It's going to slow it down. But yeah, they should all start having their teeth brushed at 6 months of age. And little dogs and cats should have their teeth brushed or teeth cleaned before a year. Large dogs, anything over, say, 40 pounds, you can wait till 2. But again, it's not a bad idea. And what I tell people all the time, periodontal disease is 100%, without a shadow of a doubt, it is 100% preventable.
Mm-hmm.
It is 0% treatable. The problem is that we, as a profession and clients, we all practice, our doctors, our dentists, we all practice preventative care. Preventative care has become a huge thing, right? Number one, you guys go to the dentist every 6 months?
Yeah.
I hope. I mean, I did pre-COVID. I mean, it's been a little weird, but you go every 6 months. You brush and floss your teeth every day.
Yeah.
Prevention, mammograms, PSAs, colonoscopies, all those things. Preventative care. In veterinary medicine, we recommend vaccines. We recommend annual exams. We recommend, senior panels in our animals. Preventative care. What do we do in veterinary dentistry? We wait for disease to be there and then we treat it. And the problem is, by the time we can identify gum disease, it's super advanced. You cannot adequately diagnose. It's been proven in study after study. You cannot easily diagnose or adequately diagnose early stages of gum disease. You can't on an awake exam. Under anesthesia, you can find it. They bleed when you probe them. You can see it on the inside, but you cannot accurately diagnose the early stages of gum disease on an awake exam. So if you are out there in the audience saying, how do I decide if my dog needs a cleaning? How long has it been? I mean, if your dog has been over a year since it's had a cleaning, the answer is yes, it needs a cleaning or she needs a cleaning. And I say it to people all the time. Well, how do you decide when it's time to go to the dentist? You get a card in the mail, you get an email, you get a text, you get something like that. You go every 6 months. You don't wake up in the morning and, pull on your teeth and go, it's not loose yet. Like,
You're absolutely right. Yeah.
boyfriend will still kiss me,
Yeah.
No, you go every 6 months for prevention.
Yeah. I wanted to ask two more questions. We're way over
Yeah.
time. I'm so sorry. But one super quick one, or maybe it's not quick, but if you see blood when they're
Yeah.
chewing on a chew, concerning? When is it concerning?
Um, when is it concerning? Yes, when you see it. So,
Anytime. Okay.
anytime when you see it, when you see blood on the toothbrush or on a chew treat, it is a sign of gingivitis. And actually, we talked about you cannot adequately diagnose gum disease. What
Mhm.
that means is the first sign of gum disease is bleeding upon brushing and probing. So if you see blood on a chew treat, it's because of gum disease.
Good to know.
Yeah,
And
need
then
for cleaning.
since we're talking about cleanings, I know what you're going to say to this,
Yeah,
but I'd like you to tell the audience,
agree.
what do you think of the non-anesthetic dental cleanings that are
It,
available?
this I am not worried about lawyers at all, but this is my one number thing. I can say this. This is my, because I'm saying this because it's being recorded. In my opinion, there we go. Animal cruelty.
Really?
Yeah, if there is one thing that I could do in my career, it would be to get rid of that. It is
How?
horrific. It is the worst thing ever invented. And this is again my opinion, but it's not just my opinion. The World Small Animal Veterinary Association, WSAVA, considers it an animal welfare concern.
Wow. I mean, I knew you were going to say that it's not useful for treating or preventing dental disease,
No,
but
not useful, it's worthless.
I did not know you were going to say that it's animal cruelty.
Okay.
It's because they wrap them in a towel and just like shove the thing in their mouth while they're awake. It makes sense. It makes
Well,
sense when you're saying it.
that's part of it. Okay. There's many reasons. That's part of it. Okay. That's number one. Number two, that is a small part of it. The bigger part of it, though, is the fact that you cannot clean underneath the gum on an awake dog. You just can't.
Right.
There's no way they're going to let you scrape underneath the gum.
Correct.
That's the only place that matters if you clean. If you clean the surface of the mouth and the surface of the teeth, but you don't clean underneath the gum, you're not doing anything medically. Okay. So that's bad. Okay. It's just in those two things, you're stressing the dog out. You
Mhm.
can injure them. I've seen it. It's rare. I mean, usually, and I'll be honest, the people that do it, they don't tend to pin them down and do horrible stuff, but it's still stressful. No one likes going to the dentist.
Right.
I mean, it's funny. Most of the big clients I talk to are like, oh, dude, if they would sedate me, I would think it'd be great. So all the people want to be sedated to go to the dentist, but now they don't want to sedate their dog to go to the dentist, which is just amusing. But here's the
It's all money. It's funny.
yeah, it's money to a certain extent. But here's the thing. So it is worthless from a medical standpoint. Okay.
Mhm.
So from a medical standpoint, it's worthless. From a stress standpoint, it's horrible. But here's the big reason that I don't like it. Because you have clean teeth. So as a client, as a veterinarian, a general practice veterinarian seeing this pet, the teeth are clean.
Mm.
So what are you
So
going to
you
do?
think they've been cleaned? Yeah.
Correct. And then what happens, and this is why I hate it so much, is the fact that these clients come to me after having this done for years, and they come in like, well, I have my dog's teeth cleaned every 6 months, and a tooth just fell out.
Oh,
Or my dog still has bad breath. My dog's breath stinks, but I have his teeth cleaned every month or every 3 months or whatever it is, and his breath stink. And I'm like, because you haven't cleaned the teeth. And then we anesthetize the dog and we extract. I mean, I've literally
oh my
extracted
God.
every single tooth out. The crowns are completely clean, but the area under the gums are horrifically infected. So
Wow.
that to me is the biggest problem, is that it provides a false sense of security.
Wow. I am so glad I almost didn't ask because
No,
we're
I
running
know.
out of time. I'm so glad I asked.
Yeah, that thing. Yeah,
Wow.
yeah.
There's a lot of aspects to that I hadn't considered, but I am glad that we're telling people not to do it.
Mm.
Wow. Amazing. Is there anything that you had hoped that you'd get a chance to say that I haven't asked you before?
Um, Let's see that okay. Let me just put it. Let me just put it this way. We talked about gum disease, and everyone talks about bad breath and tooth loss being the worst thing that can happen. It is so much less than that, or so much worse than that. The small dogs, they get nasal infections. They can get eye infections and lose their eye. They could break their jaw. They can get a bone infection called osteomyelitis. It's an increased risk of oral cancer. Not only that, periodontal disease spreads the bacteria throughout the entire body, and it does negatively affect them. Now, again, there's no cause and effect for it, but these animals do get infected, and they do, in my opinion, and this has to be my opinion, periodontal disease kills pets. So it's not just bad breath and tooth loss. It is a severe systemic infection.
Yeah.
And these animals need to be treated.
Absolutely. I mean, that's true of humans, right? I've heard gingivitis can be very dangerous for humans as well because it gets into the blood.
Exactly.
You said.
It's got hundreds. I mean, if you go on and you Google, or go to PubMed. PubMed, if you guys are really interested, go to PubMed and put in periodontal disease systemic effects, and it's going to be hundreds. And if you guys are a couple of things I'll give your audience, because you probably have a few vets of your audience, a few things that you can go. If you go to my website is dogbeachvet, DOGBEACHVET.com. On our website, we have client educational videos on everything that we talked about tonight. Periodontal disease, periodontal therapy, stomatitis, broken teeth, retained deciduous teeth, malocclusions. It's a video, the exact same thing that I would talk to my client, how I would explain it to them. That's number one.
Amazing.
For veterinarians out there, or for anyone that is interested in the real thing about this anesthesia-free thing, on the website of the World Small Animal Association, which is wsava.org, is if you Google the dental guidelines, if you go there and search guidelines, it's a 100-page document that's all about stuff. And the last thing I'll say, I'll back onto my website. I wrote I wrote the book on gum disease in dogs and cats. I wrote the book on breed-specific disease in dogs. But what we also did is that we wrote a booklet in client language, so it's not medical, it's client speak, on dental disease in little dogs. And so it's all about little dog dentistry and periodontal disease and the systemic effects, the local effects, and how you treat them, and the fact you can anesthetize small breed dogs. It is a free client educational PDF on our website.
Amazing.
Go to the website, and then you can download it. It's a free PDF. You can read all about how to take care of your little dogs.
Thank you for listening to the Enlightened Pet Behavior Podcast. I hope you and your beloved pets have found valuable insights for a more harmonious life together. Please remember that this podcast provides educational information only and is not a substitute for professional veterinary or behavioral advice. If you need personalized support, please don't hesitate to contact me and we can explore how we can work together to achieve your pet behavior goals. You can reach me at enlightenedpetbehavior.com or via email at susan@enlightenedpetbehavior.com. Special thanks to MacLight for composing the podcast's music. You can find him at maclightsongwriter.com. All these are in the show notes for you. Treasure those fur babies, and I'll talk to you next time.